Welcome to the Beats from the True Wellness Center. I'm your host, Kelly Kennedy, and the Beats is truly from my heart to yours to help you empower and inspire you to learn how the body actually does work. I am bringing you my friends, my colleagues, the most incredible minds from around the world that I have been able to learn from, and I want to share them all with you. So that's what the Beats is really about, is teaching people what I've been able to learn about how the body works and trying to give that to you in a very simple and practical way to give you things to change your life, because you got this. This is all about you and having the ability to heal your own body from within. And that's really my message, is from my heart to yours. Welcome to the Beats. Welcome to learning how your body works, and welcome to opening your heart. Thank you for joining us today. Thank you for your time and your attention as we focus in on this week's episode of The Beats. Welcome back to The Beats with Kelly Kennedy from the True Wellness Center. And we're very excited to have Dr. Rachaele Carver back, biological dentist. And I have asked Rachaele today to go through very quickly and succinctly the foundations of biological dentistry, because I feel Dr. Carver has such an ability to eloquently, simply educate, inform without overwhelming, but to educate us all about something that so many people are just unaware of, that this is a topic much like the lymphatic system that is not talked about a lot. And until oftentimes people are desperately ill, have tried everything and been everywhere and tried everything else, it hasn't worked. And what we're here to share with you is, before you go everywhere and try everything else, look inside your mouth. So thank you so much, Dr. Carver, for being here. And as always, I love being with you.
Yes, yeah, me as well. And thank you for having me again. So I've read a couple of quotes, that they say 80% of disease begins in the mouth. So that's crazy. And the reason why so much of this goes unnoticed, undiagnosed, unthought of, even by dentists, is because so many things happening in the mouth are asymptomatic. You don't feel anything in your mouth. But, when we're thinking about cavities and amalgam fillings, which are a bunch of different metals, thinking about these silent infections, they all drain via our lymphatic system down to the rest of the body. So that's where that systemic component comes in. Everything in the body is connected. Any kind of infection is draining into the rest of your body. And you think about, what's a common symptom? Brain fog. That infection right here in the brain, sinuses. So many of us have, fungal infections. I use a 3D cone beam machine, and you wouldn't believe how many things I see in the sinus, congestion, and people have no idea. They're like, I don't feel anything. And so it could be transient, but also it could be, low grade chronic inflammation in the sinuses, which are also contributing to symptoms. So very, very important.
Yeah, and I appreciate you saying, so let's back that up just really quick and unpack that. So what you're saying is that 80% of all illness can start in the mouth, but we don't feel it, so we don't know it. And then when somebody does investigation, like you have with your cone beam, you can see these either local, causing a local infection that's asymptomatic, or more of a distal issue systemically. And the question then becomes, but why, Dr. Carver? Why would something in my teeth cause something farther away in my body? Aren't my teeth just in my mouth?
So I think the important thing to remember is that a tooth is an organ. Every single tooth is an organ. So it's not just a mechanical, chewing thing that we need to masticate our food. Every tooth has its own blood supply, lymph supply, nerve supply. Anybody who's had a toothache knows that there is nerves in your teeth, okay? And often we think about cavities, I didn't brush enough, or I ate too much sugar, or I didn't have fluoride. It has nothing to do with that, very, very minimal to do with that. Because what's happening is the fluid flow, instead of coming up and bringing nutrients from the blood supply into the tooth, putting those minerals out into the outer surface of the tooth, it is actually it reverses. There's a parathyroid hormone, and when the body is acidic, there's toxicity, then we reverse the fluid flow. So the lymph now, instead of bringing healthy stuff to the top of the tooth, the lymph is pulling those minerals back into circulation because it's the minerals which create proper pH balance, right? And when we have a lot of infections and a lot of toxicity, we become acidic, we need to neutralize those. Then our enamel is deficient in those minerals, and it's more susceptible to the normal acid and bacteria in the mouth. Okay, so
wait, see why we had Dr. Carver back on. So let's unpack that, go a little slower because you're so brilliant. Let's slow it down for them, for all of us. So not them, not saying you all aren't intelligent, you're super intelligent, but I just want us to really let that land. So if everything is going well, then the lymph circulates everything up to the tooth gets the minerals that are circulated through the lymph, and it helps the outside enamel of the teeth, which are living organs that are connected to a lymph supply, a nerve supply, and a blood supply. And if what's the scenario that it would go off, that it would go the other direction?
So let's say you have a gut infection, or you're toxic, you have Lyme, you have a virus, you have whatever it may be.
Okay.
The environment in the body becomes acidic. So whatever it's from, whether it's a heavy metal, a pesticide, glyphosate, you name it.
Or a combination thereof, throws the pH off. And now when the lymph travels up, instead of giving, it's taking the minerals because the body wants to win. It wants to communicate and needs to correct the balance, the homeostasis. So it's taking the minerals from wherever it can get it.
And we're going to sacrifice the teeth, right, for the rest of the body. The internal organs are more vital than the teeth. So that's the body and its innate wisdom saying, where can I get minerals from? If I'm not absorbing them from my diet, right? So many people with decay issues have a leaky gut. They're not absorbing foods properly because of, again, all this toxicity. And so that's a big problem. We have to get our minerals from somewhere. So we're going to look to our bones, and we're going to look to our teeth. So cavities become more apparent. Gum disease. Gum disease is basically an autoimmune reaction where, because of toxicity, the bacteria, you don't all of a sudden swallow bad bacteria and get gum disease. That's not what happens. What happens, because of this toxicity, literally the bacteria become bad bacteria. So think of yourself as being hangry. You're not yourself. You're angry. You're just a completely different personality. And that's what happens. These bacteria transform into the more pathogenic, problematic bacteria, which send off all these signals to the immune system. And then the immune system actually, you start eating away your own bone, right? It's not that the bacteria eat the bone. The body is reacting to this infection, this inflammation, and it destroys the bone in the process. So again, that's what we're always thinking about, this environment. How can we get rid of that acidity? Make sure we have enough of the minerals. And along with that, when we think about teeth too, the fat soluble vitamins are very, very crucial because, right, we know calcium is a big component of our teeth, but without vitamin D and without vitamin A and vitamin K, we can't put that calcium in the bones and the teeth where it needs to be. So remember, everything has to work together. So again, if our digestion isn't working, we're not getting the minerals, we need the fat soluble. So everything has to kind of work together there.
And so if this is new information to you, there is a dental chart that has been circulating that we'll put it below this podcast, a link to it. And it talks about every tooth and the meridian and the organ system that it is connected to and relates to. And I went to Cornell University. I switched from pre-med to pre-vet. And so I would just like to make the point here that if you own animals and you take them to the vet, the first thing they do is look in their mouth, check their teeth, check their gums, check their tongue to ensure the health of the organs. I don't know when, but according to Dr. Carver, it happened sometime in the early 1900s that the ADA and the AMA split up and go, oh no, teeth are over here, the rest of the body's over here. Vets don't know that. Right? Do vets have their own? Is there a dental vet line of people that I don't know about? No. So the vet takes care of the teeth and the body together. They're the physician for the animals. They just have to learn a hell of a lot of animals' bodies. Humans, one body. We have two specialists that go, I'm working in the dental field. No, I'm working in the rest of the body, not in the dentist, not in the mouth. And what we're trying to get people to realize is your best physician is your biological dentist, because they understand how to treat your entire body from your mouth. And as what Dr. Rachaele Carver just said, 80% of illness starts in the mouth, and 90% of all illness is emotional and has to do with your lymph and your acidity from those emotions that's contributing to the things she's talked about. So we need to look at the blockades to healing, scars, and dental foci. We're going to talk a little bit more about that and why that blocks the nervous system. But are you starting to understand this connection better? That the teeth, it's not just about having silver fillings. It's about, oh, why do I have cavities? And as Dr. Carver said, it's not about fluoride. It's not about what I'm putting in here, brushing my teeth, and the care. It's about the care here that's contributing to that.
So what Kelly's talking about with this meridian chart is fascinating. When I learned this a couple of years ago, I mean, I see it every day in my practice. You know, for example, one of the things that I see most often is an upper first molar, either side, that's connected to the breast meridian. So if I see a woman, you know, who maybe has a history of breast cancer or family history, and there's a problem there, whether it's an infection, a cracked tooth, maybe they need a root canal, I'm having that conversation, you know, that you might want to think twice about a root canal on that tooth. Or I had one really interesting case, new patient, and he really unremarkable health history, except he'd had follicular lymphoma of the ureter. I was like, wow, never even heard of that. Okay. And so I did the exam, everything looks good. I look at his x-rays. He had one root canal right on the front tooth on that meridian. So again, now not to confuse people. Okay. A root canal doesn't cause cancer. Okay. But what happened is, think of the tooth as a circuit breaker. So when you have a root canal, you remove the nerve, the lymph, the blood supply. Okay. So this is dead. It's kind of, I talk to my patients a lot. It's like when you have appendicitis, we don't, you know, open it up, flush it out, shove some rubber in there, and then suture it back in your body. No, that makes no sense, right? It's dead. We take dead organs out. So dentistry is the only profession where we keep dead organs in the body. Okay. All well-meaning, because obviously nobody wants to lose their teeth. And when you have a root canal, oftentimes it feels better. And then you go about your day and everything feels great. But what we have to remember, it's a dead organ. And when things are dead, what happens? They harbor bacteria, viruses, parasites, Lyme, you name it, okay? Because those pathogens know that they can go up into those areas of the bone. Nobody can see them, because without blood supply, the immune system cannot, it doesn't travel by there. It doesn't see it. But meanwhile, those pathogens, basically their byproducts, their poop and their pee, basically, that is getting into the lymph system. And that is draining down your neck, affecting the vagus nerve, right, which innervates every single digestive organ. If your vagus nerve, and most of us, this is a big problem, most of us are in that sympathetic state already, then you add a tooth infection on top of that, and it's why we're all so stressed out and we're all aging and yada, yada, yada. We can't get better because we can't calm down the nervous system. So anyway, so when we think about that circuit breaker, okay, so the circuit breaker goes down. That means anywhere along that pathway. So, right, so in his ureter, because he had, you know, some inflammation, and if you think about the immune system having about 100 soldiers, let's say, if 60 of them are up here trying to deal with this little chronic inflammation, then you only have 40 left. So anywhere along that pathway, if you get more inflammation, or, you know, we make cancer cells every day. So if you only have 40% of your immune system to fight that cancer, it may or may not win. Okay, so again, not to say a root canal, a lot of people freak out like, oh my God, root canal is causing cancer. No, but it's all related energetically. You have less of ability now to be able to fight off the cancer cells and the other inflammation that happens in the rest of the body. So, and again, I see that connection everywhere. Every tooth is related to an emotion as well, right? So if you think of like the canines, right, our pointy teeth, that's related to the liver, where we have anger and resentment, things like that. So, you know, and I see a lot of emotional connection with pain, and emotion kind of goes hand in hand. And as biologic dentists, we understand, as Kelly was saying, we understand the philosophy of how the body works together. So if you don't treat the whole body, including the emotional and the physical, you may not get, you know, full resolution. You can't get to full health. So as Kelly was saying, I think that's great that she said that, but it's really true. That's how I feel about myself. I'm treating so many of my patients for everything because I understand what is at the root.
What is at the root? So says the biological dentist. Put a pun there, Dr. Rachael.
Yes, yes.
And I also want to just take a minute to say nothing in the body is separate. It's all connected, as she had said. And so when we have a physical stress and emotional stress, it's affecting the vibration of the body. What we're doing to eat, to handle our emotions is going to affect not only, and our self-care is not going to affect only our teeth, but it's going to affect distally, and then distally can affect locally, because it's all connected and it's all one working unit. And that our job is to not look at, like, as biological practitioners, bioregulatory practitioners, not to like, okay, let's get everything out of your mouth that's horrible. Let's go at a pace the body's ready for. Let's go in the order in which makes the most biological sense. What's the most offending thing? But what we want to bring your attention to is this connection that has been so separated out from when people are looking for true health and true healing. And to Dr. Rachael's point, it's not that you can't get well if you have root canals and silver fillings and amalgam fillings and all these things in your body. You just might not be able to get full resolution. And what we look for is full resolution by dealing with root cause. And we know that root cause has to do with innate intelligence having a blockade, and that's often dental foci. So if, from your perspective, Dr. Carver, if, first of all, can you give them an idea what dental foci means?
So foci means focus area, right? So a root canal, for example, as I said, because it's something dead, it likely is going to harbor, some kind of pathogen up there. So as I said, if your immune system is trying to deal with that, there's less capability for the immune system to deal with something else. And we know, I often tell people, if you had an abscess on your arm, big red, maybe it didn't hurt, but you wouldn't leave it there, would you? No. And again, that's the tricky thing in dentistry, because so many times, unless a dentist is looking for something, that's why x-rays become important, because you don't see things a lot of times. So, and I also think if I have a patient, let's say she has 3 root canals, 100% healthy, has no issues, am I going to go in there and am I going to rip those root canals out of there? No, but I'm going to have a conversation, that, we know that this can happen. So, things develop. So they're aware that there is a potential, issue right there. But every person, I think the other thing about bioregulatory medicine is we're not treating a tooth, we're treating a person. And you have to consider the entire picture of, when I'm talking to a patient, I'm asking about their childhood. I'm asking about their bowel habits. I am asking the whole gamut to really understand where because you can say, well, how's your digestion? Oh, it's fine. How often are you going number 2? Once a week. Well, then your digestion's not fine, right? So, there's certain questions too that we really, really need to ask.
Yeah. And look, as you said, not separating out, but full on, like, for me to maybe lose my 2 front teeth if I had root canals and had to have them extracted and put, and zirconium implants in might not be so stressful for me. But if I was an actress or, I made my money off of being on camera all day long, that'd be super, super stressful. Or if I was a, speech pathologist or something like that, where I was dependent upon using my mouth, that would stress me out. So that is all to be considered. And that's what we're saying. Like, for me, the biggest offending substance is the silver amalgam fillings, right?
And the big thing too, what we see all the time is, yes, with the amalgams, they've got, silver, they've got mercury, and you're giving off this mercury, they'll tell you, oh, they're perfectly safe. But, we've seen lots of studies that every time you chew or you have something hot, you're releasing small amounts of this mercury vapor. And again, it's when we think of disease, it's not all of a sudden something happened, I got sick. It's the gradual, the filling of the bucket, if you will, the time. And it's interesting because I have patients, who are older, maybe in their 70s, and, they've got a mouthful of amalgams and they're perfectly healthy for the most part, right? But today we have 80,000 chemicals in our environment today. Our children are born with their buckets half full. So a 30-year-old with a mouthful of amalgams is sicker than the 70-year-old because their immune system isn't as strong as that 70-year-old who grew up eating natural, healthy food, didn't have plastics in their environment. It's very different. So that's why some dentists are like, that's ridiculous because look at this population. Well, our bodies have completely changed in such a short, like one generation. It's kind of tragic, and the children I see today, the mouthful, of cavities. And again, it's not about brushing and flossing and fluoride, right? Our diet and our environment is killing us. I mean, and at a faster rate and earlier. So that's why these days, trying to find those sources of immune dysfunction is important. And the greatest thing about the mouth is accessible. It's a lot easier to just pull out a root canal than have, your appendix out for a
internal surgery, right?
Right. Yeah. Have gallbladder out. Well, maybe there's something else that's creating all that issue. So, so the amalgams, the biggest thing we see is also dissimilar metals. So if you have an amalgam or a silver filling next to a gold crown, or even next to a porcelain fused metal crown, those two dissimilar metals are creating a battery. Right. And so if you think about scars and you think about these foci, which is basically when you have a scar or some kind of infection, that energy stops, right? It's kind of like, you're going on the train track and the little, thing comes down. I can't go anymore. Right. And this is what scars do. This is what infections do. And so we need to remove that so that the train can pass through. And so again, you have those dissimilar metals, you're creating this weird battery. So that can have an effect on the heart and the rhythm there. And cavitations, that's another word that we certainly didn't learn about that in dental school. So that's when a tooth had been removed and the bone didn't heal in properly. I think this is more common than not, because again, we're not really trained in dental school how to properly clean out the socket, because most of the time you take out a tooth and it'll heal over. The mouth, the mucosa of the mouth is amazing. It heals so quickly. It's just phenomenal. So you can heal over and still have a hole in the bone and not realize, again, that's another great hiding place for Lyme and, bacteria, parasites, you name it. They love it. It's nice and warm and nobody's bothering them. But again, that's getting out into the lymph, draining down into the vagus, into the nervous system, and wreaking havoc.
And so first line is look at your silver fillings, amalgam fillings, never cross midline, just a couple of things to say, only go to a properly trained bioregulatory dentist, biological dentist. I know Dr. Carver just got back from a conference with give me the name, IAOAM.
IAOMT.
International Association of Oral Maxillary something.
It's International Academy for Oral Medicine and Toxicology.
There you go, and toxicology. So that's a properly trained dentist that understands this. Smart dentistry is another term, but these are two different things. And it's not just saying that everybody that took these classes has got it. It's saying that they're willing to be open to it, and then you do your own investigations to assure that they're doing the precise techniques and protocols and are really doing it and living it. Any other advice you have about picking a bioregulatory dentist?
Yes. So actually, Caitlin Sazowski, I can't remember.
Yes.
You know her? So she has a great, I think it's called the dentalchecklist.com. And so it's a group of questions that you will ask your biologic dentist, because this is what's really important. At the IOAMT, anybody can join. And then to be SMART certified, which means safe mercury amalgam removal technique. Right. So, you watch a couple videos, it's not that rigorous to be able to get that certification. The other organization is called the IABDM, Biologic Dental Medicine. That also, theirs is called PROTECT protocol, but it's the same thing, how to safely remove these fillings. Because again, the worst time to get exposed to mercury is when you get them put in and when you get them taken out. So when they're taken out, you're creating a ton of vapor and you're breathing that in. So we want to try to minimize that as much as possible. So at the IABDM, you have to undergo more rigorous certification. You have to show 2 case studies. So, that's another organization you want to look for. I'm certified at both. And then there are different degrees, whatever. But I like that checklist. So if you can maybe put that in the notes. And those are the questions you want to ask when you're seeking out, because anybody can call themselves biologic.
Can you repeat what you just said?
Anybody can call themselves biologic. There's not a specific certification, board certification. It's not a recognized specialty.
Yet, Dr. Caratola,
Right.
Dr. Carver, and many others.
We're working on it.
We're on the mission. But this is where you have to be, you either need to get a concierge, like oftentimes we serve as a concierge, I'm sure Dr. Carver does as well, and help you navigate these waters. There's a cost to that, of course, or you can do your own research, but just know that we are working diligently to get people trained properly, but there is a lot to this, and they are all self-trained. These are heart-centered, precise scientists that are also physicians of the mouth and happen to have a license as a dentist and go, wait, there's a better, safer, more effective, efficient way to do this that's working with the organism and the biology of the body. First offending substance, or do we have anything leaking that's really easy? As she said, access point to get out. Amalgam silver filling's easy. Find the right dentist to do it, interview them, interview perhaps some of their clients, or reach out to a concierge like us and help you navigate those waters. brmi.online is another great resource for finding bioregulatory dentists. Number 2 is look if you have root canals or cavitations. So looking, number 2 is gum disease. Right? Would you say number 2 is gum disease?
Yes, that's a big one.
So, and how can we tell, or are there any indicators, or how do we check?
So, sure. I mean, if you are bleeding when you're flossing or bleeding when you're brushing, that's gum. Now, there are varying degrees of gum disease, right? From gingivitis all the way to severe, periodontal disease where your teeth are falling out of your head. But you don't necessarily have to have bone loss to have gum disease. So the easiest indication is bleeding, okay? And some people say, oh, well, I'm not going to floss because it hurts or it caused bleeding. Well, the reason there's bleeding is because there's plaque buildup. So the more you floss and the more you clean that area, the less bleeding there will be. So that's a number one indication.
And it's probably an indication that the gut mucosa is off as well, because the gut mucosa and the gums are severely related. And so if we want to see our gum health, that's why vets, listen, I was an animal science major. The first thing we do, we were doing nutritional research on dogs. What we do is we look at their gums, we check their hydration through their gums, we look at how the teeth are seated, we see if there's any swelling. We were doing nutritional research. We had to look inside these canines' mouths, and they were all huskies and they had big mouths and they didn't like their mouths being touched, but we had to look in there and really see what was happening when we fed them beaver meat versus when we fed them salmon, and what the difference was in how it, and then we draw blood and we look at what it did to their physiology. But first we looked here to see if we had to stop our protocols before we got to the point where we were testing. And then I got out of that world. 10 years later, I get involved in bioregulatory medicine. I'm like, really? I'm back looking in people's mouths now? No offense, Dr. Carver, but I don't know how you dentists do it. It's a lot, and there's a lot going on. And I have to say that most of us don't know about our mouth. I mean, I didn't even know what a root canal was 15, 18 years ago when I was introduced to bioregulatory medicine. Honest to God, I didn't know what a crown or a cap or what the difference was. I barely do now, to be honest with you. And, there's just so much to know about our mouth. Porcelain fused to metal, she mentioned. I found out that's typically nickel, like what they use for car bumpers, which causes severe itching a lot in people with toxicity to nickel and severe skin rashes. And so there's all sorts of things that we have to learn, and there's a pace and an order and proper expertise that need to be employed when we do this. But please start to look at this mouth-body connection is what we're here to help you understand. And do not get overwhelmed. Just start getting the information.
That's right. And I think what Kelly was saying with the concierge is, it's really, there are some biologic dentists like myself who I also have a health coaching certificate. So I understand nutrition very, very well. And so sometimes there's preparation before you get your amalgams out. So you may find a biologic dentist who knows how to take it out properly, but do they know how to prepare you before and after? So this is sometimes where a team comes into place. If you have a naturopath or, a doctor who, again, is a little bit more holistic, somebody like Kelly at the True Wellness Center, where they understand, what's happening in the body, that we don't want to overlook that too. So when you're meeting with your biologic dentist, you're talking about the procedure, And then you may, again, want to have another professional if your biologic dentist isn't fully, into the nutrition background. You want to make sure you're covering all bases, because like I said, even though we do our very best to mitigate any release of vapor, depending on how sensitive you are, some patients, no big deal, they don't necessarily need a lot of prep work. I just will give them a specific heavy metal binder beforehand and some maybe antioxidants afterwards. Some, like some who've had major infections, we'd have to do a little lymph work even, if this isn't, that's the other thing, right? Which Kelly knows all about. And if you're listening to her podcast, you know all about the lymph. If the cervical lymph nodes are all blocked, and then all of a sudden you start to take all these infections out, what's going to happen? Maybe you get more brain fog, maybe you start getting headaches, right? Because you're not draining this area. So again, these are all things to, especially if there's infection, got to make sure that lymph is open and draining first. I think most of us who are in the bioregulatory, we really understand that before detox comes drainage. So,
and you can see why, come on. Here's the thing. I want everybody to understand. First of all, I love Dr. Rachaele Carver on many levels, both professionally and personally. But we could not do at True Wellness what we're able to do without biological dentists. And today, I did not see clients today. I did a lot of filming, a lot of videoing, but I had 3 people I had to talk to today because we're working with different clients. And I'm just sitting here very aware. They were all biological dentists. Literally, I talked to you, Rich, Dr. Porcelli, and Dr. Caratola today, because one's in South Carolina, one's in New York, and she's in Connecticut, right? Connecticut? Massachusetts. Those 2 states, I don't know why I cannot separate them out from my brain, but it's like the mind body. It's Connecticut and Massachusetts. But point being that, again, the most important team member I have is a biological dentist. And what I would say is the most important team member they have, I'm going to maybe counter a little bit of what she said, is every single person needs preparation and every single person needs work afterward. The easiest part is sitting in the dental chair. The hard part is getting out of the tissues after you've sat in the dental chair, the leak has stopped, and now we clean up the tissues for the next couple years as we open up the lymph and the fascia, handling the scars and handling all those endotoxins and pathogens that were stored in that body, whether that's a cavitational surgery or amalgam remediation. But please know that I firmly believe that every single person needs to prepare before and after, because as what Dr. Carver said earlier, we live in a toxic soup. What this organism is up against now is very different than what our 2 generations above us have dealt with. They are healthier, even though they live in the same environment, because they've been living in this environment they had a step up when they walked in because they weren't as toxed out. So it took them longer to get sicker. We're getting sicker faster now as an organism, as a species, because we come in preloaded and then live in a much more toxic environment than we've ever done before. We've never put our organism under so much pressure as we have, and we need to release that pressure. And those pressure valves are typically in your cervical nodes and in your gut, because that's where 80% of your lymph is in your neck and your gut, and 20% is everywhere else in your body. So you cannot get well and really resolve a case without handling the dental piece. The dental piece has to be done at the pace and the time, not in fast. Go slow, handle it properly, handle your lymph, and nurture your body through this process. And it should then go very gently, comfortably, easily, slowly, watching you gradually get better and better and better and better and better. Is that what you experience in your practice?
Absolutely. And that's an important thing to know. Like if somebody's watching this and says, oh my gosh, I have, 6 amalgams and 3 root canals, and, they start to freak out a little bit. This is a marathon. This is not a sprint. And again, if you start ripping things out too fast and not in the right order and not prepared, you can make yourself sicker. So it is, what is the highest priority? And you start there and slow and steady, and know that, we've got your back. We know what to do. We know what we're dealing with. And it does not have to be stressful. It can, be a really, really nice experience, because we have all this time to spend with you and walk you through. And through the process, you really start to understand more about your body. And what I love is when people come to me and say, I don't think I need to take 2 of that supplement. I'm feeling 1. And I think, okay, I'm like, so you're listening to your body, you know, and when patients intuit, you know, as children, we have intuition, right? And, you know, but we lose all that as we grow up. And so I love that when I hear my patients like, I think this might be the problem, you know, or if somebody comes into me and like, this tooth is painful, whatever. And I always ask them, what do you think is wrong? Right? I mean, you know your body better than anybody else. You know what you can handle. We are here to help and guide you, get you what you need, but it has to be a partnership. It's not the doctor, the dentist knows all. Listen, you know, shut up, open your mouth, and I'm going to do what I need to do, right? Really, if you really want true wellness, you got to take ownership of your health. You know, that's that emotional component. None of us are victims, right? We have the capability, our body knows how to heal itself, right? We have to take away the burden. We have to put back everything that's missing. And we need to do it with love, right? We've got to have that graciousness and the peace, and obviously much easier said than done. But again, Kelly and I are saying, you know, it all comes together. But people like Kelly and I who are trained this way, we understand that. And so we, you know, can be really helpful along the whole journey in many aspects, not just the mechanical part of it.
Thank you. Thank you. I'd asked Dr. Carver to come on because I wanted to create a quick, perfect timed thank you summary of this work so that people can really get a good piece of it, so you can start to do your own research, you can find the right people to align with, you can get the right support, and you can actually, and she didn't mean to say it, but create true wellness in your life. Thanks, lady, for helping really achieve that innate wisdom, as I got chills when you said that. I love that too. I love when the clients, after working with themselves for some time and working with us and having that body awareness, start to come and go, well, I feel like maybe I need this. And I'm like, awesome. Biology, not chemistry. Go. It's so exciting. And that's what we're here for. Truly, from our heart to yours, we want to empower you to take more precise, conscious, and effective action. And we know that starts in the mouth. And so from our heart to yours, enjoy your day from the Beats here at the True Wellness Center. Thank you so much for listening today to this episode of The Beats. And as your host, Kelly Kennedy, truly from my heart to yours, thank you for your time and your attention today. And if this did resonate with you, please do leave some comments. We would love to hear from you. And if this further you think would resonate with somebody that you know, please do go ahead and share that and hit that notification button so you know when The Beats is available to you. We do some live things every once in a while. And watch out for some of our upcoming events. We have a node release class coming up in the local area here in Pennsylvania. Ian has a walk coming up, so you can check out some information on our website, the True Wellness Center, about all the details about those upcoming events. And as always, we pray that this information today was not only foundational, but raised some questions for you and helped you be empowered to take actionable, profound steps toward regeneration, because your body is the only thing that heals. And that is our message here on The Beats. Thanks again for listening and for sharing. Have a great day.